familiar with pain. It can be a burning sensation for some, while for others, it can be a piercing or sharp type of pain. And the experience can differ from one person to another. It also makes a difference if you have a high or low tolerance for pain. But when something hurts, your body is actually telling you something. I'm Dr. Freddy Gomez. Join us on Medtalk Health Talk as we talk about the causes of pain and the many ways we can treat or manage it. Pain can range from just being uncomfortable to debilitating. But for the most part, it's a signal that your body is telling you something. Joining us today are Dr. Maria Elena Lourdes Tan. She's a rehabilitation medicine specialist from the Makati Medical Center. We're also joined by Dr. Michelle Pia Eustaquio, who is an anesthesiologist and diplomat of the Philippine Board of Pain Medicine. Thank you both for joining us. It's good to have you on the show today. Now, all of us want to know what really happens to the body when we experience pain. Dr. Eustaquio, can you please explain this sensation to our audience?
Okay, so according to the International Association for the Study of Pain, or IASP, pain is defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So what do we mean by that? Pain in general is a personal experience. It is influenced by a lot of factors. There can be biological factors, which is the actual tissue damage. There are psychological factors, which can be aggravated or alleviated by anxiety, depression, even stress. And it can also be alleviated by social factors, such as having family support or emotional support when one experiences pain.
And now, there are different causes of pain. Alam natin yun lahat. But one of the most common ones is a headache. Now, I know many of you will say that headaches are even more common now given our work from home situation. Now, what else should we look out for when we get headaches? Now, this question is for Dr. Tan. What are some of the common triggers of this very common pain that a lot of us experience nowadays, yung headache?
Headache now is mostly caused by stress. Just like you mentioned, the work from home situation has become more stressful on others. So I'm sure Doctora will agree, we do have different types of headache. Most common that I see is usually your tension headache, or what we call your cervicogenic headache. So tension headache is usually, just like the photo is showing, usually in the temples or in the forehead, but then they also have usually pain in the back of the head or occipital area.
Definitely, there are a lot of variables when we talk about this very common pain, na headache. Now, still with Dr. Tan, it's a stressful time, and if this is the cause of headaches, like what you mentioned, it's very common, what's your recommended treatment advice for a headache?
So I usually start with just your NSAIDs before I go higher. If I deem it to be cervicogenic, I usually suggest the patient to go for physical therapy as well.
And in addition, some of our daily activities can also cause headaches. Whether you're having your meals on time or sitting up properly at your desk or giving yourself a break from long hours in front of your computer, it's worth assessing and evaluating. If your headache is persistent or if it's recurring, give your doctor a call. Napakauso na ngayon ang telemedicine, so give your doctor a call if you want some clarifications on that. Now, I want to talk about migraines this time because a lot of people just think about migraines as a headache, but just worse. Now, patients will complain about a pulsating, painful sensation at times, and it also may come with nausea and vomiting. Now, Dr. Eustaquio, could you please share with our viewers what can cause a migraine and how is this treated more oftenly and effectively?
Okay, migraine is a type of headache. It's usually described as throbbing, one-sided, and it's associated with sensory sensitivity. When we say sensory sensitivity, those who are sensitive to light, sound, and movement. Migraine causes are not fully understood, but they say that genetics and environment may play a role. Like what we have now, we are common with our work to be in front of the computer most of the time, and that could be a trigger to migraine. Okay, so other triggers could also include hormonal changes in women, alcoholic drinks, stress, lack of sleep, sometimes too much sleep. There are also certain food that may trigger migraines, such as food additives, food that are high in MSG. They can also trigger migraine. And as mentioned, the sensory, when you stimulate your sensory, like for example, having bright lights, loud sounds, even strong smell of perfume, cigarette smoke, that can all trigger migraine. So knowing what could trigger migraine, basically to treat it, we have ways of controlling migraine by lifestyle adjustments and maybe some use of medicines. When we say lifestyle adjustments, healthy diet, regular exercise, to have regular sleep patterns, and minimizing stress.
Depending on the cause, there are many different ways to treat a headache or a migraine. Now, Dr. Tan, could you share with our viewers what are some of the tried and tested and effective ways of treating these headaches that our viewers can do themselves?
It's very important to know the cause of the headache. So this can be as, let's just say, benign, or as simple as lack of sleep, or it can be usually caused by stress. So if medications do not work, especially if your patient has allergies, we can do this simple massage. If you have a temporal headache, meaning in this area, you can try to massage, try to relax the muscles if it is a tension type headache. If it is a cervicogenic headache, if you feel the back of your neck is quite tight or tender, some stretching exercises that we teach and that we ask our patient to continue at home. This is also, Doc, what you've been mentioning about taking breaks. If your job requires you to stay in the computer for prolonged hours, every 2 to 3 hours, I do suggest to take a stretch break. Hydration is, yes, correct. Also, like you mentioned, Doc, your meals, it's very important to make sure that you take your meals on time. If you can take a full meal, a simple snack of crackers or juice, and water is also very helpful as well.
Coming up, what are some mind and body techniques that can help manage pain? We'll look into those later on. You're watching Medtalk Health Talk, your partner in healthcare. It's a pleasure to have you with us on Medtalk Health Talk. I'm Dr. Freddy Gomez. Thank you very much for watching. Now, pain is unpleasant and it can be uncomfortable. And sometimes it can get in the way of our day-to-day lives. Abdominal pain is another possible cause of pain. Usually when we see our patients, we ask which part of the abdomen hurts because it can help with the initial diagnosis. Now, the main causes are infection, abnormal growths or masses and tumors, inflammation, obstruction, and intestinal disorders. Now, Dr. Tan, we mentioned infection and inflammation, and the culprit usually is some form of gastroenteritis. Can you take us through that pain that a patient will experience, and why does this happen?
Okay, for abdominal pain, I guess the most common complaint I've encountered in the clinics, it's more of like a cramping pain or a bloating pain. Seen in the screen, simple constipation can really give some discomfort, But still, I would still always consider if it's a pulled muscle, Our abdominals can cause pain aside from these ones that are already written.
Now, aside from inflammation or infections in the stomach, diseases that affect the organs in the abdomen can cause some form of abdominal pain. Now, Dr. Eustaquio, what type of pain should our viewers watch out for when the organs in the stomach or the abdomen are already affected?
It depends on what might be causing the pain. So usually the doctor should usually ask the patients for the location of the pain. If it's in the right side, the left side, the upper quadrant, the lower quadrant. We also usually ask for the onset and the progression of the pain, because if this has been happening for a long time already, then this is something that might be serious, okay? But at the same time, if it's something that is just happened like a few hours ago, then we should also ask further about the quality of the pain. Is it stabbing? Is it tearing? Is it burning? Or is it just simply feeling bloated? So these are the characteristics that we have to watch out for.
Now, gallstones can be also a cause of pain in the abdomen as well. So what causes this buildup of gallstones that leads eventually to the sensation of pain?
The gallstones, I believe, will always depend on the size and the amount, no, because we can have multiple stones in the gallbladder. So this could be considered as what we call your visceral pain. So the nerves, of course, in the area are the ones that bring your unpleasant sensation. So this one, usually you do have pain on your right upper quadrant. So just right upper quadrant. But then this pain can also radiate to the back. So when you get this type of history, you always have to consider that your patient might have gallstones and request for imaging.
Okay, now this question is for Dr. Eustachio. I'll still sort of stick with the abdominal area because, as we all know, the appendix is a small pouch or a tube in our lower abdomen, and its function is a little bit of a mystery, but when it gets inflamed or it gets infected, this can be a problem. So, Dr. Eustachio, paliwanag natin kung anong klaseng pain at bakit ba nagkaka-pain ang isang tao kapag may appendicitis?
Appendicitis is a form of inflammation. So any form of inflammation can cause swelling in the area. And when there's swelling, then it triggers a lot of signals for pain. With the acute appendicitis, there is an infection already that is starting. Initially, it is felt in the upper quadrant, and then later on, it migrates to the right lower quadrant of the abdomen.
Is surgery pretty much always the option when it comes to that, or can medication alleviate some of these symptoms?
For acute appendicitis, usually it depends on the progression of the pain. But if it is acute appendicitis, more often than not, they have to undergo surgery to remove the inflamed appendix.
When you go see a doctor for any sort of pain, you're usually asked the level of pain that you feel. Now, Dr. Eustachio, is the pain scale helpful for the doctors assessing the pain, and how is this usually done?
Actually, measuring pain depends on the age and the condition of the patient. So for those who can describe and verbalize their pain, we measure the intensity of the pain either three ways. First, we have the visual analog scale. Second, we have the numerical rating scale. And third, we have the verbal rating scale. When we say visual analog scale, we usually use this with the faces pain scale or FPS, like what is flashed. The FPS shows different reactions or faces of a person experiencing pain, from someone smiling to someone with extreme facial grimaces. For the numerical rating scale, we ask the patient from a score of 0 to 10, 0 having no pain at all, and 10 having the worst pain in your life, how would you grade the pain that you're feeling right now? And lastly, with the verbal rating scale, we simply ask the patient to categorize their pain. How do you feel right now? Can you say it's no pain, mild pain, moderate pain, or severe pain? Then whatever report they say, then that would be the grading for their intensity of pain.
You're watching Medtalk Health Talk. When we come back, relieving pain by identifying pressure points. What are they and how do they work? We'll find out after this very short break. We all know when something hurts. That pain, whether it's in your head, stomach, or other parts of the body, it tells you something. It can be short or acute, and long-term or chronic. And depending on the cause, treatments will vary. Now, this question is for Dr. Tan. What are the different ways in order to treat this vast array of pain that people may feel? Let's focus first on pain-relieving medicines. What are the different types and what are the intentions of each group?
Of course, our first line is always your NSAIDs. So these are your paracetamol, ibuprofen, your coxib, celecoxib as well is another popular prescribed drug. These class of medications basically aim to decrease the inflammation in the localized tissues as well. It will always depend also on the type of pain. We also have something as what we call your neuropathic pain. So most of your pains will have radiating pain, usually down the arms or for the legs. This pain is described as electric-like sensation. For this pain, another medication that we usually use is your anticonvulsants. What I like to explain to the patient is like it stabilizes the signals that go through the nerve. So these are the two things that I usually use. If these medications do not work, then we move up to the opioids. No? Most commonly used in my specialty is the low-dose opioids. No? But of course, if this doesn't work as well, especially for your post-surgery patients, usually I've seen them give the higher dose opioid.
For some patients who experience extreme pain, there are such a thing as opioids, as was mentioned, but they require a prescription and may be addictive at some point, which means also that later on they may no longer work. Now, Dr. Eustaquio, what are some of the dangerous side effects of these types of drugs, these opioids?
So with the opioid medications, we usually prescribe this to patients who have cancer pain. And the usual common side effects that we explain to the patients would be feeling of nausea, dizziness, vomiting. But more commonly, opioids are associated with constipation as well.
Okay. Now, for millions of people around the world, acupuncture is a helpful way to manage pain. Dr. Tan, when does acupuncture work?
The difference with acupuncture to other medications, sometimes it gives faster relief. Most likely, it's the way that the needles are applied on them. So this is also part of our treatment armamentarium, is I think the word I was looking for. So one benefit of it, of course, there's really not much side effects to it because it is a traditional form of medicine. But for patients who do not usually respond to the more common treatments that we give, they do benefit a lot from acupuncture.
Now, there are studies out there saying that regular exercise can also ease the pain. Is this true, Dr. Tan? What's the science behind this, how exercise can relieve pain?
For exercise, no, it's basically just to keep your muscle strength and flexibility at par, no, or at level. Also, the exercise can release some hormones. I think the most commonly mentioned is what they call your endorphins that try to that also help relieve your pain. Also, being active as well can also bring a sense of well-being to the person. So it's not only a physical benefit, but also a psychological benefit as well.
That's right. Now, from exercise to relaxation and meditation, these are some techniques that can help with pain relief. But the reality is they don't work for all types of pain. So what's important is to consult your doctor if the pain is unusual, severe, or ongoing. With that, I'd like to thank our guest for today, rehabilitation medicine specialist, Dr. Maria Elena Lourdes Tan, and anesthesiologist, Dr. Michelle Pia Eustaquio. We hope this conversation has been helpful. Choose well and be well. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.